Hi folks, today we're going to be talking about designing verifiable health solutions for a global pandemic. We've got a lot to cover, but I'll be trying my best to balance the high-level overview and also the right level of technical depth. It's a pretty heated topic, but I hope everyone here at least walks away with a slightly different perspective of what's possible. But first, my name is Mark Funk, and I've spent the last 15 years building, designing, and reviewing things. Before I started my own consulting practice, I was in full-time consulting roles at places like Google and Square. I've worked with a lot of teams, big and small, across a wide variety of problem domains, helping people de-risk their products. I'm going to be talking about the global pandemic that started early last year, specifically about the US because that's where I live, and we've been having a really bad time. Certain things appear to be working elsewhere that just aren't working here, and it's going to be a sobering topic. Many of you watching will have lost friends and family over the last year, myself included. The death toll and damage to society has been overwhelming. So this talk is going to be centered around a project I started in April, where I donated some time with a new nonprofit organization full of tech industry folks and health policy experts. And they brought me in to imagine a new privacy architecture for a pandemic solution for a world with tests and vaccines. But I stopped that work shortly after my initial design when it was clear I was designing something for a world that wouldn't exist for a while. So the theory is that you can proactively prevent COVID-infected individuals from entering the space by enforcing a strict set of policies around entrance. And contrast this with contact tracing, which is about reactively tracing infected people's contacts and notifying them to isolate and get tested. I believe that containing a pandemic effectively would require strong efforts on multiple fronts, and while I admired the work of privacy-preserving contact tracing proposals being published at this time, I had reservations about how well an opt-in system could work in the US. But what was compelling about this project was that everything was already closed, and if we built a tool that could be used to reopen spaces and didn't need to reach some critical mass to protect people, then it would provide immediate benefit, if it could actually keep people safe. So what does it mean to check policy compliance, and would it keep people safe? So you've probably seen these health questionnaires if you've gone to any medical facility or other building in the last year, and if you answer yes to any of them, they say you should isolate and get tested. But it requires that you have knowledge and truthfulness of your symptoms, which makes it largely self-attestation and only provides weak assurances. But there are approaches with stronger assurances, like a viral diagnosis test will tell you if you have a detectable level of infection that would indicate ability to pass on the virus, asymptomatic or not. And some countries and states already require people to take a test 1 to 3 days before and after traveling. A vaccine administered indicates potential immunity and ability to pass on the virus, with a duration of confidence that stems from research, clinical trials, and patient statistics. Vaccines for other diseases are already extensively required for traveling abroad, enrolling kids in school, and even for some jobs. So the proposed way to make this easier is by sharing data via scannable paper ticket or QR code from your phone, like we're used to for air travel or concerts. But do we need to share our medical records for safety? Is self-attestation good enough? The short answer is no, and the reasons are many. COVID spreads quickly across the population and requires consistent mitigation practices. And in the US, health recommendations are fairly moderate to lax, and enforcement is lax to non-existent. And economic inequality and poor social support have left individuals in positions where they have to prioritize income over their own safety. And while keeping potentially contagious people out, you also need to account for certain social elements. Like many perceive a lack of symptoms as not infected or transmissible, which can compromise a network of social bubbles. And there are many people who are just willing to take risks to continue their normal lifestyle, or they thought it wasn't going to be a big deal for young people. And this one's really frustrating. There's just people who believe outrageous disinformation like COVID's a hoax, or that 5G antennas cause it, or that vaccines cause it, or that masks don't do anything. So I didn't think we could rely on the good faith participation of members in society. So I believe that symptom checkers had weak assurances, while infection diagnosis and vaccination records have stronger assurances. They're also not trustworthy unless you can prove they're yours, and this means that very sensitive information might be required to do this properly. So will it be worth it? What's the privacy risk to you? Here's a high-level technical overview of different data architecture options. A centralized database is the traditional approach for data services and online identities, which ultimately requires that you trust your controller to be a good custodian of your sensitive data. But this likely isn't going to work with a solution like this, because even though you trust your healthcare provider to manage your health records, you don't want them to know every place you check into. But the peer-to-peer design is pretty interesting, has great offline usability, but it's difficult to have the same authenticity and privacy assurances that you would with a centralized solution. And there's another decentralized option referred to as self-sovereign identity, but it concentrates more on the online identity aspect using decentralized identifiers, data control via asymmetric cryptography, and publishing it somewhere publicly available on the blockchain or some federated solid pod. And frequently these proposals seem to conflate data control and privacy, so I'm not sure if it would work for these purposes. And they just didn't describe solutions for exposure risks when you're publishing sensitive information under a pseudonym and sharing references to untrusted parties who might use it to correlate your actual identity and track you over time. So, looking at the centralized design again, some East Asian countries like Singapore have been doing really well containing the pandemic, using their mandated centralized solutions. So instead of moralizing our differences in privacy ideals, we have to ask, would it work here? I don't think so, and I'll tell you why. It asks far too much from a country fiercely struggling against structural discrimination and government surveillance. It's very conceivable that location data would directly harm Black, Indigenous, people of color communities, Muslims, immigrants, LGBTQ folks, and other groups. And these centralized solutions are already showing their potential to be used against citizens' best interests. So what happens when you leave the data sharing between individuals? Well, you shift the trust model significantly, cutting out a convenient position of surveillance. Some manual contact tracing efforts took the approach of sharing direct personal information, and folks found out the hard way how decentralized threat actors can also be a danger. And regarding public ledgers and decentralized identifiers, if they don't change over time, they will be used to track your identity, presence, and activity. So what would I do? I would choose a decentralized offline storage approach using peer-to-peer data sharing, but I would centralize other portions to obfuscate identity further, creating temporary credentials to reduce tracking risk, and without compromising authenticity. And I would rely on that central authority to delegate the function of handling sensitive information to trusted agents. But would it be worth it? Who would this actually serve? Well, many calls to reopen have been to save our economy, but I would remind them our economy is made of people and we should instead help individuals reinforce firmer boundaries in their own bubbles, help communities protect themselves from uncaring outsiders and a world on fire, help workers demand safer environments from their employers, and help us reduce the disproportionate harm it's doing to Black, Indigenous, people of color communities. These numbers are devastating and should shake you to the core. And if that doesn't terrify you, more than 6% of our population is unemployed and 7 times that is going hungry. So staying home indefinitely clearly only works when you have the privilege and resources to do so. So let's start talking about a potential solution. So here's a high-level overview of the various actors and points of trust. First, there is a central authority which delegates functions to trusted individuals for creating health and identity credentials. It itself creates specific credentials I'll talk about later on, and it keeps a revocation database for invalid keys. Identity verifiers are trusted agents like county officials, employers, school administrators, and they can provide certified proofs of a valid type of ID being tied to a user's device. They are also responsible for tracking the number of registration attempts. Health workers are trusted agents who, with access to patient health data, can provide certified proofs of viral tests or vaccines administered. Policy administrators are also trusted agents like federal, state, county officials, or employers, school administrators, and even private business owners. They're the ones who publish policy requirements for their area of authority, and their authority is hierarchical, only allowing them to set stricter requirements than their county or state allows. Policy checkers are untrusted agents who check individuals' credentials for policy compliance, but these could also be machines controlling a door entry system. Individuals are just people seeking entrance to shared spaces who must prove their health policy compliance to do so. So what do health policies look like? These aren't actual recommendations, but just showcasing the different policy capabilities. State-level policies can even be defined on building code occupancy type, like schools, offices, elder care facilities, and spaces and their policies are published, so individuals using the app can find out whether they meet the requirements ahead of time. Additionally, standard policy recommendations could be available for individuals' use within their own bubbles. But there's also a lot of educational opportunities. Policy admins can create soft requirements that can't be technically validated, but serve as useful guidelines, like must wear a surgical mask, no cloth or valve masks, must keep 10 feet of distance, or must not admit more than 12 people at a time. If a place requires a test or a vaccine and the individual doesn't have one, that's also an opportunity to help them find the nearest clinic and schedule a visit. So let's start talking about the protocol itself. It's critical to not require an online identity, since tracking movements in the real world poses too dangerous a surveillance risk. We'll rely on some pretty boring asymmetric cryptography to produce trustworthy proofs and minimize data exposure requirements. We'll also prohibit using static identifiers or fingerprintable data when checking into a location to prevent others from correlating your identity and other information over time. From an interactive proof perspective, individuals are the provers and they make requests to verifiers to validate their credentials and receive useful proofs in response. The transport mechanism is not strictly tied to QR codes, but it works over the network as well, and they can even be printed out on paper by trusted agents, with some known risk trade-offs around having a longer expiry period. The interaction is a two-step request-response, and in the request, the assertion object contains information that requires verification, but is to be kept off the record, and the prover object contains a public key uniquely generated for the interaction. And in the response, there's the trusted verifier's signed public key, the prover object from step 1, and the outcome object, which should never contain personally identifiable information, but may have general information like vaccine type and date administered. And you can later prove ownership of this proof by presenting it along with a new signature with that same interaction key pair. Glossing over the details, here's a more approachable high-level summary. It's how individuals would make a request to healthcare workers or identity verifiers in order to acquire the proof they need to meet policy requirements. On the other side of that transaction, this is the response you get back, and remember, you can prove ownership of it by presenting it along with a new signature and the same interaction key pair. This is an important part of the pseudonymization strategy because it allows you to claim this voucher as yours without exposing new personal data. So let's explore the purpose of identity verification. Its intention is to make it costly to construct fraudulent or multiple identities. The safety risk mitigation is about discouraging users from attempting to reset their health status when they should be isolating. And it's technically possible to inject code to subvert cryptographic functions, which allow you to change the photo and give your phone to someone else, or extract your private keys to transfer to a cloned version of the app. But this is a defense in depth exercise since we can't put PII in the outcome object of the proof without defeating our pseudonymity objectives. But I believe it's costly to scale and a decent deterrent since it requires you to verify a valid identity that may be revoked via mechanisms later on. Exploring the purpose of health verification, this one's pretty straightforward. When you go in for a test or a vaccine, you receive a proof that you received one signed by your health provider that's not tied to your identity. And while I talk about QR codes as the solution, you could use providers' digital health solution to a similar effect. But that's a significant unspecified integration project. Well, this is exciting. Now you have all the things you need to prove you can adhere to the strictest of policies. But you shouldn't give them to random people. They can contain health information you don't want tied to your identity. And while they are pseudonymous, they contain static information and are thus fingerprintable, which means they can be used to track you as a persistent digital identity that becomes correlated with your physical locations. Thus, on some regular timed interval, a device sends its proofs to a central authority along with some wide locale information to get a temporary credential used for admission. And in response, your device receives a proof from the central authority called the ephemeral pass, and also a collection of policy hash digests signed with this proof for every possible policy combination in your wide locale that you're admissible for. It's a layer of indirection for reducing information exposure and tracking potential. The central authority doesn't store any information or log request metadata, but if you're worried about government surveillance abusing the central position, if they wanted your PII or health information, they can more effectively go straight to the source with county officials and healthcare orgs. If they want all your location check-ins, they would have to collude with every single policy checker, which seems so impractical to be considered implausible. But failing to uphold our pseudonymity principles elsewhere can have severe privacy implications here. So the organization that runs this has to be super transparent about their operations, security, and privacy. But anyways, once individuals have this pass, it takes very little to prove their policy compliance, and they don't need anything in return, so it's functionally a one-step interaction, which means a verifier doesn't need to construct the full interaction object containing the outcome, but they may want to if they need to submit information to the central authority for fraud or abuse. Let's talk about that. While policy verifiers don't have your identity, your credentials are still revocable. Valid reasons might include suspected identity fraud or malicious noncompliance with other safety requirements, like refusing to wear a mask, social distance, or other reckless health behaviors. I've made this technically possible but largely undefined, since it requires thoughtful rules involving scoring thresholds and policy checker reputation. Doing this right would be a significant challenge, since false positives create a huge burden on individuals to renew their credentials, and decentralizing policing without thought often enables forms of discrimination I wanted to avoid. Remember when I talked about how health questionnaires aren't trustworthy and exposure notifications don't guarantee isolation? Well, it's possible to add some small assurances around these processes by verifying people's attestation ability or their isolation status. The idea is that you start with the credential that says, yes, I'm healthy until I indicate otherwise, which is good enough for less strict policies, but when you self-report symptoms, get a positive infection diagnosis, or receive an exposure notification, your attestation credential becomes revoked so you can no longer check into places. And when this happens, you can get an isolation proof with some exit requirement, like waiting some amount of days or getting a negative infection diagnosis. Here's what this might look like. An individual downloads the app, enters their info, and acquires an attestation proof. This allows them to get passes. And as some time goes on, each day they use the app and it asks them if they have any symptoms. Well, one day they report having a mild cough and slight fever, so the app revokes their attestation proof and acquires an isolation proof. In this case, they only have to wait 10 days before they can exchange this isolation proof for a new attestation proof, and then they can acquire passes again. Well, many days later, they receive an exposure notification from another app, and some mechanism allows this to exposure notification to revoke their attestation proof and begin isolation. And instead of waiting 10 days, they visit a testing site, and later on they receive a private message from that clinic with an attached health proof of a negative COVID infection status. And once it's added to their app, they can exchange the isolation and health proof for a new attestation proof. And it only takes 3 days this time. So now that we're closing, I want to walk through what I believe should be the main takeaways. Disinformation is running rampant. Anti-maskers and anti-vaxxers are a risk to themselves, their bubbles, and everyone they interact with. So we need controls that can protect people from widespread ignorance and contempt for scientific consensus and health recommendations. Digital contact tracing works well when a lot of people use it and when they receive an exposure notification, reliably isolate themselves and get tested. Since neither is well enforced here, we should probably look at other approaches as we gradually reopen shared spaces in the US. We are already using personally identifiable and trackable test and vaccination information to restrict movement. I expect the scope of this to increase more as people get vaccinated and we reevaluate the risk of keeping shared spaces closed. On that note, I believe you should not have to publish any form of digital identity on a public blockchain or use fingerprintable identifiers in the real world, nor should you have to share your health information with untrusted individuals, nor should you have to expose your location to a central authority. Conversely, I believe you should be capable of verifying yourself offline, because the real world's complicated and connectedness is not always reliable. And having something printed for you on paper is also important since not everyone has equal access to technology. So we can't use this as a tool to only lift restrictions for the privileged, and this is why tests and vaccines need to be widely accessible and free for everyone. But even if that was the case, we can't create false urgency for stuffing kids in poorly ventilated classrooms, reopening crowded restaurants, or leaving your mask at home. We just don't have enough data on immunity yet, which means the policies are unclear, but we do know vaccines play an important role in healthcare, so we need some better infrastructure in place until we know more. Hang in there and stay safe. Lives are still at stake. Thank you.